Is your infant crying or super fussy and you're not sure what kind of hacks to help them calm down? This video is just for you.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. My name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. And today I want to talk about a topic I wish somebody had spoken to me about when I had my newborn, and that is ways to troubleshoot your fussy infant. So I think a lot of the time parents, when their baby is crying, not only is it really hard emotionally on you when you're sleep exhausted and you can't figure out what's wrong with your baby, but also I think a lot of the time we kind of chalk it up to infant colic, and we don't talk to parents enough about ways that they might mitigate some of that crying. So I have some favorite techniques I want to share with you guys today. First and foremost, I think the most important technique for newborn parents to know about are really the 5 S's. And we've talked about this before in our show, and we have videos on how to do some of these. So I definitely go back and reference those videos on how to swaddle your baby, etc. But let's quickly review the 5 S's because I think this is a super helpful technique. I use it here in my office all the time when infants come in and they're crying and I need to listen to their heart, or they're crying and I want to be able to talk to their parents, or just don't want them to cry because I feel bad. So 5 S's, swaddling. So that means you need to swaddle your infant very tightly. If you can get 2 fingers or at least 1 finger underneath their swaddle, that is loose enough. The most common issue I see with swaddling with parents is they just have it too loose. So the whole point of the swaddle is to prevent something called the Moro or startle reflex. Your baby's hands kind of go up in the air uncontrollably. That is very startling to them. And anything can trigger it, movement, sound, the wind kind of brushing against them. And so having a really good tight swaddle is really the first part of trying to soothe your infant. I definitely encourage first-time parents who are uncomfortable with swaddling to reach out to their healthcare provider, their pediatrician, to have them demonstrate a safe swaddle. And one of those things is making sure the hips are nice and loose. So first part is swaddling, and again, go reference that video if you want to. And the reason that you need to start off with the swaddle is the second part of the 5 S's is the sideline position with swaying. That's the third. So if your infant is not swaddled and you try to sway them or rock them, you might startle them and trigger that Moro reflex. So get a good night's swaddle on, then get them in the sideline position, support their head with the crooks of your arm, a little gentle pressure on their tummy, make sure their neck and they are well supported. And then you can sway them or rock them or just walk around and jiggle them gently. So that's swaddle, sideline, swaying. The 4th S is shushing. So babies seem to find this sound very calming. We think it's because it sounds like the umbilical artery. So all those pregnant mommies, when you went in and they put the ultrasound in your tummy, you heard the sound of your umbilical artery, which sounds a lot like whoosh, 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 which also sounds a lot like shh, 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 shh. So good, strong shushing for a couple seconds. And then the 5th S is, if necessary, you can offer them something to suck on. The tip of your finger or pacifier works nicely. If you're using a pacifier, when your baby stops crying, you should remove that pacifier. You should not leave it in for them to continue to suck on. Once they've stopped crying and they're nice and calm, if you, now that's a good time to put your baby down in their bassinet, hopefully. So 5 S's is a great tip to try to use if you're dealing with a fussy infant. Number 2 is water. Babies love the sound of water. So turn on your sink or your faucet. Let them listen to the sound of running water. If you want to, you can use lukewarm water and let their just kind of dribble over the top of their head. If that doesn't work, you can consider baby wearing. There are some studies that show that baby wearing significantly reduces the amount of crying a newborn does. So again, refer back to our video on how to safely baby wear. You want to have them in a good, nice W position. Make sure the top of their head is seeable and kissable, and that they are the proper weight for that carrier. But again, baby wearing is a really great tool for a parent to have in their toolkit if they are dealing with a fussy infant. For it, the least, probably the most important is actually reach out to your pediatrician and make sure that there's nothing wrong. Make sure they examine your baby, that there is no potential signs of a corneal abrasion where they scratch their eye, that they have no scratches in their skin, that their ears are nice and clear, that they don't have any fever. So get a good examine, especially if it's the first time your baby's crying, or they have not been crier and all of a sudden they're very inconsolable. You need to reach out to your pediatrician in those instances. But also reach out to your pediatrician and have them check in and make sure that your baby's getting enough food. So if they're crying every hour, you feed them a couple minutes, and then 30 minutes to 45 minutes later, they're seeming hungry and crying again. I would reach out to your pediatrician in that instance and make sure they're not concerned that they need more food or more feeds. And I think probably underrated thing that your pediatrician can check on as well is to make sure they're actually not getting overtired. So newborns can only stay up for about 30 to 45 minutes. If your baby has been up for an hour and a half, and then you're trying to put them down, it's very likely that they are overtired. And when we're overtired, we produce a lot of cortisol that makes us cranky. It actually makes it harder for babies to fall asleep and harder for them to stay asleep. So do reach out to your pediatrician if you've tried a few of these things and it's not the first time your baby's cried, so they've already had a nice normal exam. Reach out to them, have them take a look at their what we call wake windows when they're going to bed and when they're waking up. So you might want to record that information for your pediatrician ahead of time. And their feeding schedule. Overall, I hope you guys find this video helpful. I think some of these tips would have been super helpful for me as a first-time parent, so I hope you find them helpful. If you're a parent or you're out there in the community and you have other great tips for parents to soothe their fussy infant, please leave them below. We love to hear from you guys. And if you're going through the thick of it, reach out to your pediatrician or your support, if that's your family, friends, loved ones, to help you out in that kind of difficult time.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.